it's been a little bit since you've come into the clinic. How are you doing? Okay, all right. So you'd say that for a few years your periods have been sort of irregular? Okay, all right. Now, how do you define irregular periods? Do you get multiple periods in a month? Do you go long periods of time not getting a menstrual cycle? So at times you go 3-4 months and no period. Okay, okay. And has anyone ever diagnosed you with anything? Ever given you medication? They've just given you pills in the past and sent you on your way, but never had an official diagnosis. Okay. So you have no known medical conditions right now, and no new surgery since I saw you. Okay. And then smoke, drink occasionally. Okay. And then as far as being sexually active, any chance that you're pregnant at all? You're not on birth control. Okay, all right. I know. A lot of times people with irregular periods, this is just normal for them, and being pregnant is not really in the thought process at the time. Okay. Any new partners since I saw you? Same person. Okay. Alrighty. Now, aside from your irregular periods, are you noticing any other changes throughout your body? You're having a lot more acne, more facial hair. Okay. Any difficulties losing weight at all? Okay. And when was the last time that you've seen a primary care doctor for like standard blood work? It's been a little bit. Okay, no problem at all. So, if it is okay with you, I just want to get some vital signs right now, just so we have the basics. And then before you go in during your examination, I'm just going to ask you for a urine sample. It's a formality, not that I think you're pregnant, but we definitely have to rule that out. Okay, cool. So, let me just grab some hand sanitizer. Family has been okay? Good. And no one with COVID, right? Okay. Just the electric blood pressure cuff. Nothing new. Want to do this arm? Okay. Alright. I'm gonna start it now. Okay, blood pressure's normal. Just a temperature check, the one under the tongue. You've heard of PCOS? It's good. It is so good that you're educating yourself. Yes, definitely something we will look into for you today. PCOS, it's a relatively common condition. I believe 1 in every 7 patients can have it. Mild, moderate. The spectrum is kind of, some people have more mild symptoms where they don't really notice much of anything, and so they go most of their life undiagnosed. Or some people kind of have more moderate to severe PCOS symptoms. So we will definitely look into that condition and talk about it a little more. If you don't mind lifting your tongue. it is okay with you, and it's totally okay if you're not okay with it, but just to be thorough, you're gonna leave me that urine sample, okay? And then we will have you get undressed waist down for a pelvic exam, just to make sure we do our due diligence. But of course, you can always decline that. You're okay with it? Okay, and then while you're here, I figure we can also just do an ultrasound to rule out any anomalies internally. What a lot of people don't realize is during pelvic exams, we actually cannot visibly see your ovaries or your uterus or anything like that. So the ultrasound will provide a lot more clarity as far as any cysts or anything else going on. Cool, and then we'll kind of discuss further if any blood work is needed, okay? Absolutely. I'm gonna put your vitals in. And so here is the cup. I just need you to leave me that urine sample. We'll confirm, of course, you're not pregnant, and then we will move forward with the rest of the exam. Beautiful, yes. I'll leave this on the counter here for you. Once you leave that urine sample, you come back in. I'll leave a drape over at the medical table for you, and you'll just get undressed. Beautiful. All right, I will see you in a second then. All right, pregnancy test was negative, so we're definitely going to want to look more into why you are missing your menstrual cycle for periods at a time, okay? So if it's okay with you, we're going to start with a routine pelvic exam first. Just going to look on the inside, rule out anything obvious, and then if it works for you, I was going to use the transvaginal probe ultrasound just to take some pictures. Yes, I always tell people that with conditions like PCOS, you can still have PCOS or Polycystic Ovarian syndrome, but not necessarily have abnormal imaging. Not all PCOS patients have polycystic appearing ovaries. Interesting, right? All right, let me grab some gloves. You, of course, let me know if any of this is too uncomfortable. Absolutely, yes. All right, I'm gonna put some lubricant. Very good. Okay, you're gonna feel my hands here. Doing okay? You're doing great. All right, so I'm seeing no abnormalities internally. All right, let me take this out. What I would like to do is just an exam with my fingers. Of course, I'm gonna put some lubricant. You let me know of any pain. All right, very good. Just gonna exchange the gloves here. The next part is going to be the ultrasound, okay? So maybe a little bit uncomfy. If you want, you could insert the probe yourself. You just rather me do it. Understood, understood. All right, give me 1 second. I'm just inputting your information into the ultrasound machine. All right. You're gonna feel a little bit of pressure here, okay? Okay. All right. I'm just gonna be taking pictures of what I see, okay? just seeing a simple cyst on the right ovary, but not any polycystic appearing ovaries so far. Yeah. Just a few more images and then you're all done. All right, I got all of the images that I need. I'm going to pull this out now. All right, very good. Let me kind of wipe you off here. All right, so you know what? I am going to have you get dressed, and then we're going to talk about the next steps. Yes, for sure. Okay, you get dressed and I'll be back in. No problem. Okay, so let's talk about what our next plan is, okay? So a lot of times there are 3 major criteria for a patient to hit that may have PCOS or polycystic ovarian syndrome. And this is essentially a hormonal imbalance. Now, the 3 criteria are as follows. The first one is oligomenorrhea or amenorrhea, meaning you go never getting a menstrual cycle naturally, or you may go more than 3 months or have less than a given amount in a particular year. So you hit that first criteria based off of your history of irregular periods. Does that make sense so far? Now, the second criteria is hyperandrogenism, or basically showing signs of more elevated testosterone levels in the body. Now, this can be presented in 2 ways. Option 1 is I draw your labs and it shows signs of elevated testosterone. Or you may be a patient that presents with hyperandrogen symptoms, meaning increase in facial hair, increase in acne, difficulties losing weight, hair loss. Exactly, so you have hit criteria number 2 as well. The third criteria is polycystic ovaries. So let's say you are a patient that maybe doesn't have all those symptoms, but you don't get periods and you have polycystic appearing ovaries. That's how you would hit the 2 of 3 criteria. But like I've told you, there are a lot of PCOS patients that don't necessarily have polycystic appearing ovaries. And in your situation, you are not one of those people. Exactly. And so, you know, given that you've hit 2 of the 3 criteria, it's safe to say that there's a high suspicion or that you do have polycystic ovarian syndrome. Now, what we can do just to have the thing on file is we could still get blood work. I would love to check your A1C, your insulin levels to see if you're more insulin resistant because of that. Exactly. And so the number 1 treatment modality for PCOS is actually lifestyle modifications. So getting on a good exercise regimen, adjusting diet, and we will be sure to set you up with a nutritionist just to see what sort of diet best fits in with your particular type of PCOS. Yes, and then if you are someone who is an undiagnosed diabetic, there may be other medications that could help not only manage the sugars, but also help as far as your lifestyle goals. You're going to hear a lot that people just are given the pill, they're given the pill, but there are a lot of patients that can actually regulate their cycles naturally without necessarily needing a pill. Now, in the event that we've tried lifestyle modifications and we find that we still need the pill to help for protective properties, that is completely okay too. There are a fair amount of patients in that situation as well. So birth control pills are very good when it comes to protecting patients with PCOS. Now, if you want to get pregnant or you're more concerned about becoming pregnant in the near future, we can definitely talk about what the fertility journey may look like as someone who has PCOS. But Yeah, that's kind of like a quick overview. If it works for you, I am just going to do that quick blood draw just to get the hormone labs, and then I will call you to review that and we can set up the next plan. Perfect. And I'm going to write all this info down for you so you can take it. Mm-hmm. Alright, want to do this arm? Good. Sperm stress ball. Let's clean up the area for you. And if you wouldn't mind making a fist for me. Very good. All right. Quick poke. All right. Very good. Got the sample that I needed. Let's bandage you up. Very good. Does that feel okay? Awesome. Do you have any questions as far as what the next steps are and what we plan on doing? Yes, so we're going to wait for the hormone labs, see how your sugars are, maybe refer you to endocrine as well as get you a nutrition consult, and then we will see if through lifestyle modifications your periods are able to regulate. If you're not trying to get pregnant, and if they're not kind of regulating monthly, then we may want to consider putting you on a form of birth control just to keep your lining protected to reduce your risk for uterine cancer. All right, perfect. That will be the game plan. Of course, very nice seeing you, and we will keep in touch. Absolutely. I'll see you.